From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon and welcome to 22 News in Focus. I'm Laura Hutchinson. The government recently rolled out the new healthcare.gov website designed to help uninsured Americans buy insurance through the Affordable Care Act. But the rollout has been plagued with problems, making many people wonder what this means for the system when it is fully implemented next year. And that's where 22 News in Focus comes in today. Today we're going to talk to experts about how this law will affect us and what people and business owners can do to make the transition a smooth process. Then later, staying on the topic of healthcare, October is Breast Cancer Awareness Month. Today we'll talk to a representative from our local American Cancer Society about when women should be tested. And we're also going to hear from a survivor who will share her story with us. But first, we begin today with the implementation of the Affordable Care Act. Here to start us off, we have a representative from Caring Health Center, a community primary care facility in Springfield. We have Jacqueline Johnson with us, the Chief Operating Officer. Thank you so much for joining us.
Thank you for having me.
Nice to have you on today. So first off, talk to us about what the Caring Health Center is, first of all, because you do have patients who may not have insurance.
Sure. So thank you for having us. The Caring Health Center is a federally qualified health center in the city of Springfield. We currently service around 14,000 patients, and we see about 50,000 visits annually. We have primary care, dental, WIC, a wellness center, and we have additional services like behavioral health and diabetes services, but we are primary care. And like I said, we sit in the city of Springfield, so we're right downtown, and we've been honored to receive one of the Navigator grants apart from the other 9 organizations that received it in the state. So this gave us a great opportunity to join in the efforts of the ACA reform and really get people informed around how they can qualify for health insurance if they don't have health insurance, or how they better can qualify and shop the market for a plan that suits their needs.
Very good. So this is all about getting those people who are uninsured insured, yes, and maybe even bringing the cost down for some of those people who do have insurance. So talk to us about how your transition has been. We've been hearing about this website and how it's been very difficult. Some people have simply flatlined because the website's been crashing. So talk to me about what your transition process has been like, first of all.
So before we received the funding opportunity, the Caring Health Center had already committed to having an outreach and enrollment staff. We've had them for about 7 years now, and they are phenomenal at what they do, and they help people enroll in insurance. So we've had a strong history and foundation with enrolling folks into insurance plans. However, with this added on Navigator grant, we've been able to assist people who wouldn't normally come to a health center for these type of services, or don't have insurance, or are looking for a plan much better. So we've had a team already prior, a team of 3, and now we have a team of 6. So yes, there are some sort of, I'll say some anxieties around sort of getting on the system. If I'm not technology savvy, how do I navigate it? However, my team has done an extensive amount of training between this going to Boston, staying locally, and working with other people who are entering the system as well on how to best educate patients. And something that Caring Health Center is really sits in a unique position is that we have on-site 12 interpreters who can help folks. So like, let's say someone comes in and doesn't have health insurance and our navigator doesn't speak that language. Not only do we have access to on-site interpreters, but we have a phone system where we can call and help people actually get through the system. So we are advising that people come to us. Our doors are open. We are open from 8:30 to 5, and we're willing to receive anybody. And in the event that the system isn't working, we have paper applications, and all of the navigators on site are very savvy on how to use those paper applications.
So has this been a huge boom for business for
Yes.
you? Are people coming in, walking through the door and saying, do I get health care now, or how is this working?
As of October 1st, as an example, that morning I saw 10 people in my administration office coming in, just looking for where these navigators were. So on a day-to-day, I'm seeing about 15 to 20 sort of reports coming in from the navigators saying these are as between maybe 20 phone calls and 20 people coming on site, it's been a huge increase of people looking to sort of figure out how to navigate the system. So yeah, it's been a huge boom for Caring Health, but we also feel honored that the community has chosen us as their place of education to get their health insurance needs.
What are some of those misconceptions that people may have? Does this apply to me? It seems like when some of these happen, you must be hearing a whole range of, concerns from people. What are some of those that you're hearing?
For some folks, they feel like if I don't do this immediately today, am I going to lose health insurance? Or if I get on this plan, is it going to be the wrong plan for me? Or if I put the wrong thing down, is it going to hinder my ability in the future to change my plan? And really, the trainings that the navigators have received, not only is it education around the system, but really just how to coax people through the process that it's okay. And everyone has questions around this. And when you implement any new system, there are going to be barriers, there are going to be questions, but that we're here to support you. And so that's been really helpful, so because people come in with real anxiety and sort of fear that they're not going to be able to navigate the system correctly, and then they do it and it works out beautifully.
Mm-hmm. So what are the answers to some of those questions? If I don't do it today, what does the time frame look like?
So, the connector and the Caring Health Center, we stay in constant contact with our representative, and also we've been in major contact with the customer service. And typically it takes, a couple of weeks to process the paper applications, but the online applications happen sort of instantly, they're live. And so we can call back within typically 48 hours to see what the process is, or the length of time when this person should be sort of hearing back from an insurer or whomever, like if they had questions like from the connector or from us, but it's usually a fast turnaround, and it started in October, so we're still sort of learning some of those answers as well with customer service and working with the people at the connector. But we have been able to thankfully answer most of the questions because the navigators on site are also on weekly calls with the connector, and they're answering questions as they see them rolling in from the state. So that's been really helpful.
Have your questions as a health facility been answered from has this been, do you feel that you had the materials to get this off and rolling? Do you think that you're going to be better prepared as the months tick by when this is fully implemented next year? Or
I think that
are there any shortcomings, I guess, the question there?
No, not by any means. I think if anything, this has been an amazing opportunity for Caring Health to be one of the premier health centers to sort of embark on this journey with the state and with the ACA reforms, because people who once didn't have insurance or had insurance can now qualify with a subsidy, and even if they don't have a subsidy, it feels like it's a fair market where they can navigate which insurance plan makes sense for them. And so I don't foresee any dilemmas. Yesterday one of the navigators came upstairs and she said, "This is the best job I've ever had." And kudos, because you don't get that a lot in these days and age and working in the health field. And the fact that they're all really excited and they get a lot of time to be in the community, really reaching out to all sorts of community members is really important. So in the next couple of months, I think with any system, it's going to roll around, and I think it's going to be a great success, as it has already proven.
And you mentioned earlier as well that people are concerned. What if I get into a plan that turns out isn't right for me? How much wiggle room is there once you're in one to then switch it around or make it something that works for you?
I'm not sure, because we haven't had anybody encounter that dilemma.
This is brand new, right?
But in some of the trainings that I went to as administration with the navigators, there is wiggle room. You can contact the state, and there are things to work around that. But typically that essentially wouldn't happen, because the information you're putting in, it will help direct you to what insurance plan you need.
Okay, so it is matched up on a really personal basis. And do you expect, shocking, but we can be procrastinators in the community sometimes, do you expect to see this become a much busier business and sort of take over what you're doing? Do you expect to see a huge boom? I guess I'm trying to understand how many people in the community are still uninsured or seeking this type of help, changing their insurance planner.
I think Massachusetts has been a premier state in dealing with health insurance, and we've been aggressive in our outreach, and I think there will be a boom inevitably because of the outreach measures that we do day to day as facilities and health insurers. And so some of the outreach we've done has increased the numbers of patients coming in. But I think for the most part, residents are informed and want to be sort of agents over their health insurance. This is just taking it to another level and putting Massachusetts as positioning us in a really unique place amongst the country. And so I don't think we're going to see numbers that are so far out that we're like, where are all these people coming from? But I do think we will see an increased amount of patients coming in, sort of owning their agency around their health insurance plans. And that speaks volumes for Massachusetts.
Yeah, we do sort of have a leg up with our own insurance already.
We do.
So what would you say to those people who are feeling like they may fall into the category, that this may be good for them, but are hesitant to sort of walk through the doors because they don't know what they're going to be confronted with, questions they're going to be asked? What can somebody expect if they are brand new to this and just want to get started, maybe just get some information?
Well, our doors are open. We are a team of 6 very strong navigators looking to receive people. Call us. You can email us.
Make an appointment.
Make an appointment. I've had over 10 people call and say, I just want to know, can I sign up for insurance? Or I have this. And they're going to get a friendly, warm person looking for them to come in. And I tell people, come in because we have 6 people on site ready to serve you and to support you. And oftentimes you think you have one question, it really sort of cycles out to being 5 or 6 questions. So I say come on in, meet with the navigators, see if there's any questions that are lingering for you, or maybe you know have a question of your child or your partner, whatever the situation is. Come in and we will get you to, whether it's a little question or a big question, we will help you get to your answer.
Okay, Jacqueline Johnson with the Caring Health Center in Springfield. Thank you so much for joining us and answering all of our questions. We appreciate it. And next we're going to talk about businesses and how companies that offer health insurance to their employees can come into compliance with the new law. We're going to discuss that and so much more. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. We are talking about the new Federal Affordable Care Act. We've discussed the changes to some of that program and how people are dealing with the transition. We talked about how people are able to sign up, and now we want to switch it a little bit and talk about businesses and the insurance end. And joining us here to talk to us about that, we have Peter Straley, President and CEO of Health New England, a locally run and managed care organization here in Western Massachusetts. Peter, thank you so much for joining us.
Welcome to be here.
Thank you. We were sort of really focusing on the people in our last segment, but there are business owners out there wondering what this means, and from the insurer end of this. Thank you so much for being here and answering these questions. Sure. Let's start off with, what are some of those misconceptions? This is a grand new law and people are not quite sure what to think of it. They're not even sure if they support it in many cases. And there's just a lot of unanswered questions right now as to how this is going to impact. So what are some of those misconceptions first off?
I think the most important thing to understand is that most of what you hear in national broadcast coverage doesn't really apply to Massachusetts. Massachusetts began back in 2006 to change the healthcare insurance marketplace and ultimately the healthcare marketplace. Sure. So we've been at this for a long time. So when you hear all the stories about how people with pre-existing conditions can't get coverage and now they'll be able to, we did that a long time ago. When you hear the stories about how people are, you know, their insurance is just too expensive because they had one of these conditions, again, we took care of those things a long time ago. So in Massachusetts, where we start in this is we have almost everyone has some form of affordable insurance today. And that's a very good thing. There's going to be some changes in that. Anytime there's change, there's concern, and there should be, because it's confusing. It's confusing for me, and I'm in the industry. So hopefully we'll have less confusion by the time we're done than when we started. But there will be many opportunities for people to have high quality insurance. The insurance that's offered in Massachusetts, just across the board, is very extensive coverage. There's very little that's carved out, what you hear about in other states, so none of that really happens. But there are rules that are changing, and there's going to be, as always, there's some winners and losers as you change how you rate different groups and things like that. So, you know, the connector has been in operation for years. Now, they had to do a lot of work to comply with the new federal regulations, but we've been working with the connector forever. So it's not like this is a new business partner for us or that we're new to them. We've been offered on the connector since it started. but it's changing. So as that changes, we've all had to invest heavily in new information systems so that we can make sure that we work efficiently, that the information is transferred accurately, and that people get signed up for the right plan in an efficient way. And well, again, we've been doing it for a number of years, but with the regulations changing because of having to comply with federal regulations, and then to harmonize the state regulations with the federal regulations, which are headed towards the same ultimate goal, which is to have high quality insurance for everybody in the state. But they approach it a little bit differently. And those little differences are really big when you're talking about trying to actually make it work and make sure the numbers work to the penny.
Right.
So at the end of the day, employers will have to make some changes. But the great thing about Massachusetts is that for the most part, employers offer great insurance to their employees.
Right.
And so they're going to do that afterwards. That's my prediction. Obviously, I can't tell you what's actually going to happen. But when we went through this over the last 6 years, there was all these pundits saying, oh, all the employers are going to drop their insurance and they're going to not cover it because there's penalties and things like that. Well, guess what? They didn't. Right. And in fact, more employers offered insurance after we put the law in effect than before. And again, there'll be one or two stories of an employer deciding to drop out, but there'll be more of people offering insurance to their employees and their employees finally getting it, which is what we want them to do.
So let's talk about what some of the major changes are with this, specifically for employers, and maybe it's easier to talk about small businesses, maybe under 50 employees. Maybe you can start there. What are some of the changes that we're definitely going to see?
So it is important to recognize that how small employers, those with 50 or less, are treated and a little bit differently than larger employers. And there's a third category of employers, which are the really big employers that self-insure. So, and when we talk about the market, we talk about them all at once, and they're really all experiencing this very, very differently. Again, the small employer who currently offers insurance will have many, many options just as they did before. But the options are changing a little bit. Because while before we had this idea of these levels or tiers of plans, you've heard of the bronze and gold and silver plans. Well, we now have a platinum plan. So, but the rules as to what it means to be in one of those designations have changed a little bit. So if you were an employer who maybe had the silver plan before, it may not be exactly the same as a silver plan today. It'll be similar to it. But again, anytime you change anything with an employee's benefits, it affects everybody in the company, and so the HR director, has to be able to explain this, and individuals have to be able to kind of cross-navigate the two. So there are changes taking place. Bottom line, they had preventive services that were covered with no copay by the individual before. They're going to have that again, plus a couple more services roped into that. They had broad coverage for basically all medical and surgical services, inpatient services, outpatient services, mental health services. They're going to have that as well. And they're going to have a choice of a number of different offerings within the same health plan and a number of different health plans that offer many different options. So they're going to have all that the same. But what's really different, especially for a small employer, is the rules that insurers must use to develop the rates for what we can charge for that group of employees with that insurer have changed. Some in subtle ways and some in not so subtle ways. And what it means is that for any individual employer, while the average will not change very much, in fact, rates on average are going up in single digits and less than 5%. So that's a good thing. But for any individual employer, there will be winners and losers. And the state's done a very good job of actually analyzing this. We've analyzed our own data, and people can see a 30% increase or a 30% decrease with, quote, the same people, but just a year older. And that's very disruptive for everyone. Now, of course, you won't hear about the people who got the 30% decrease because they're happy, and they should be. The folks who got the 30% increase, we're then going to have to explain to them why the regulations changed and how it affected them. So we've worked very, very hard to come up with a way of articulating that so that at least it's understandable. It may not be nice or it may not be what you want to hear, but at least you can understand how we got there. So that's one of the big changes. The other big change, which kind of is behind all that, is insurers are going to be subject to a new set of taxes. And those taxes are part of what funds the Affordable Care Act. Insurers kick in a certain amount of money, and DME manufacturers, the basic medical equipment manufacturers, and the drug companies kick in. The insurers kick in the most of that, and those, for the most part, will get passed on to the small employers disproportionately, because they're in this regulated market. And the larger employers that self-fund basically will get a pass on this. So it's one of the unintended consequences, I think, of the regulations, but it is how it's actually happening.
Sure. And for the businesses that may not have had the proper insurance before and do now, there are some sort of tax breaks included in all of this as well, right?
Sure. There are some opportunities for small insurers to get some tax breaks, and there's opportunities for more individuals who are getting insurance through the connector to have additional federal subsidies as well. So there's a larger group of people who will have the opportunity to have either a federal or state subsidy, which is a good thing, because it just means that more people will have more affordable insurance. And the employers, again, I think is our experience, and we insure over 5,000 employers in Western Massachusetts, and they're primarily small employers. They offer very rich plans. I can't think of one of them right now that offers a plan that wouldn't qualify for all the minimum essential coverage and all those other things that we don't need to get into the details of all that, because they're already meeting that requirement. Again, in other states, this is not true, and there's immense changes going on. But in Massachusetts, because we have a long history of working cooperatively with the employers, with the insurers, with the state, that we've solved those problems.
Sure.
We have to refine them a little bit, but we've solved the big ones.
So it sounds like the big takeaway is that the insurers are going to have to change their rules a little bit.
A lot.
Okay, so the insurers are going to have some major changes that they're going to have to take. The businesses, so to speak, they may see some tweaking to what their health care is. But really, Massachusetts, from what I'm hearing from you, is, I mean, so many of our businesses are already underway with it that we're not going to see a huge major boom as far as that's concerned.
Right. Now, there are some new reporting requirements that for larger employers will start to kick in next year. They were delayed this year. And so anytime there's a new regulatory requirement, it's a burden for folks who are already working hard, have already downsized. So there's some of that going on, and that's important. And there are some potential new penalties for people who don't comply. They've been delayed a year again, so I don't want to spend our time worrying about them today, because who knows what it'll be a year from now.
It might get delayed again.
But so for right now, the thing that people will really feel is this new rating methodology, which can create winners and losers, the new taxes that are added on, which costs everybody 1% or 2% more. And then some of these changes in what are called the metallic tiers, the bronze, silver plans. And I had this plan before. Why can't I have exactly that plan now? And it doesn't fit into one of the tiers, so you have to change it a little bit. And as we know, anytime you make any change and it affects all the employees, you've now got 300 questions, for one issue, and we have to be very articulate in how we answer that.
I think there are a lot of employers out there who are very happy that you just made it simple and easy to understand. Hopefully they're not as freaked out about the whole transition.
Let's hope so.
As well.
Right.
Peter Straley, with President and CEO of Health New England, thank you so much for coming on and joining us. I really appreciate it. And now we're going to find out if the state as a whole is ready for these changes. We've heard some of that, but we're going to talk to someone from the state next and get those answers. So you stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the Affordable Care Act and how the state is implementing it. Later on in the program, we're going to continue health care conversations and talk about breast cancer, talk to a breast cancer survivor. Actually, October is Breast Cancer Awareness Month. We're going to find out who should be tested and how often. That's later on in this program. But first, continuing our conversation now about the implementation of the Affordable Care Act. Here to talk to us about how the state is doing, transitioning and preparing for this, we have Jason Lefferts, Director of Communications and Media Relations for Massachusetts Health Connector. Thank you so much for joining us.
Thanks
I appreciate it.
Great to be here.
So we've gotten some local questions answered. We had somebody from Springfield talking about how people can walk in the door and get some of their questions answered. We've talked about the business and the insurance end of things. Let's talk about the state as a whole, because we are in a very unique situation to where we had something very similar in place, but there are some changes happening, and it's important to know if we're ready for that. it was a little disconcerting when the website had flatlined a bit when people were signing up and all that. How are we working through this transition?
Yeah, our website has actually done very well so far.
Okay.
This is a very big, very complex project. There are hundreds of different calculations that go into somebody putting their information into the website.
Right.
This is a big project. Our website has held up very well over the first 3 weeks.
Okay, good.
We've had some bugs, which is expected in something this big. We've fixed them as quick as we can. In a lot of cases, it's just sort of random things that just pop up. You and I might be on the website at the same time, and you might go through perfectly fine, and I run into a little bit of a problem, and by the time I report it and our team gets a chance to jump into the system, it's disappeared.
Sure.
So we've had those issues. There are times, at least a couple times a week, in the middle of the night when user volume is way down, we'll take the system down, put in some fixes, make it better.
And now this is the state website,
right? This is the state website, right?
It was the federal website that had all of those issues where people were trying to get on and log on, and it just wasn't working out. Maybe that was just a huge undertaking, but for the state standpoint, it sounds like things are moving
So
much
far,
further.
it's been great. Yeah, we have about 26,000 people who've created accounts, about 8,000 people who've finished their applications. So people are moving forward.
Wow. So we're seeing some of the numbers. We're seeing some things happen here. People are signing up. There's interest. Have you seen even a fraction of what you expect to see over the next few months?
We didn't really have any initial expectations. Our big thing at the Health Connector is that most of our current membership, the people who already have health insurance with us, they need to reapply between now and the end of the year, just so their plans and their subsidies are in line with the Affordable Care Act. So that's our big expectation. We want to get all of those people transferred and moved over into ACA compliant health plans by the end of the year.
Okay. So are we prepared for this? That's really the big question. Who needs to be most prepared right now?
Yeah, well, I think the Health Connector is probably near the top of the list, and I think our current members, they're the ones who need to take action. It's a little bit different, for you and I at our jobs. We might have an open enrollment period where we may be able to pick, from plans. But if we don't do anything, life goes on and we stay in the health plan we're in now. And in the past, that's how open enrollment periods were treated at the Health Connector. But this time, if they don't take action, they're at risk of losing their coverage. So these are the folks who, we're really, getting the word out to. You have to do something. We're calling them, we're mailing them. We just started running ads this week that's heavy on a re-enrollment message. We want to make sure that all these people know that they need to take action between now and the end of the year. And so if they go to the website today, if they're looking for subsidized care, they can fill out the application online. We'll take it. We set it aside, sort of how we have in the past, and we'll get back to them when we know what program and what subsidy they have, and then they can go and pick their plan.
So what is going to happen to people, employers, businesses, anybody who doesn't have insurance at the end of the day, when this is fully in place?
Yeah, I think for us in Massachusetts, it's sort of no different than it was before. There's still an individual mandate in pass. There's still rules for businesses to have insurance. But for us, it's something that we've been through before. We've been here before. We're used to it. For the most part, it doesn't change. The nice thing is, I think whether it's a business or individuals or government, we're all in this together. Everyone has this shared responsibility of providing healthcare access and making it affordable. And we've done a great job at it. People talk about Massachusetts being the model for the Affordable Care Act, and it is most definitely true.
So what are the major changes that you want people to expect? We just heard a lot of the changes for the business standpoint and what the insurers are going to go through, but from people walking
Sure,
around.
there are probably three main areas. It's choice, benefits, and subsidies. And for choice, we have an additional carrier. This year we have 10 carriers. We have 114 plans, which are both more than we've had before at the Health Connector. We have new benefits, including dental insurance, which people are really excited about. We haven't offered dental care in the past. We talk about how almost everyone in Massachusetts has medical coverage. Only about 3/4 have dental insurance. In a lot of cases, people don't have access to it through their jobs, like they would health insurance. So that's a big new thing that we're offering. And then on the subsidy side, there are a bunch of different areas where things are changing. But I think the biggest thing is our cap moves from 300 to 400% of the federal poverty level, and that means for an individual, someone who is making like $32,000, $33,000 before would have qualified. Now that cap moves up to about 45%, and for a family of four, that limit moves from the low 70s to about 94%. So I'm sorry, 94,000. So there are a lot of people who, for the first time, can get help paying for their health insurance.
Okay. So what are some of our surrounding states having to do to comply with this legislation? And are we having to do the same thing, or maybe not so much because it is so similar to the plan that we already had? What are states physically as a whole supposed to do to comply with
Sure.
this?
So at this point, everyone has some version of a marketplace.
Okay.
Like the Health Connector is the marketplace for Massachusetts. Some states are doing it on their own. I think Connecticut is an example of a state that's doing their own. And then there are other states who are just, feeding into the federal website, whether it's sort of a hybrid or just, purely the feds will take care of you. And I think like New Hampshire and Maine are examples of states that are using the federal marketplace. So that's for surrounding states. That's they have to get this marketplace stood up and ready to go and bring people in the door. They're also in the position where we were 6 years ago, where they're out looking for the uninsured folks. We have a very small percentage of people who are uninsured at this point, and we'd love to get them on board.
Yeah.
In the long run, that's our goal. But for other states, this is the first time where these people have the opportunity to get health insurance.
Right.
Think back to where we were in 2006, 2007, where people were like, I'm excited, I get to get health insurance for the first time. That's how it is in Connecticut, New York, Vermont, New Hampshire.
People, when they hear about the Affordable Care Act, they hear the uninsured will have insurance, and they also hear that people will be paying less for insurance. It's possible people will be paying less. Are there people in Massachusetts who fall into that? Who sort of falls into that category?
So absolutely. As we were just talking about, that expansion of the subsidy level from 300 to 400%.
Okay.
There's probably about 40,000 people statewide who fit in that category, and that's sort of our estimate on that. So all those people, for the first time, could get a chance getting help on their health insurance. And then we're also expanding the Medicaid program, the Mass Health program, so that folks who would now qualify for Mass Health can move into that, which will also be great for those people.
What do you think about the big picture of things? How do you think this transition and, having more people insured and maybe people paying less, what is the grand picture in Massachusetts? What are some changes or anything positive or negative that you're expecting to see with this implementation?
Well, obviously, we'd like to see more people insured at the end of the day. I mean, that's what this comes down to. I mean, at the Health Connector, we do have this very short-term goal of keeping our current membership. But everyone wants to get everybody insured in Massachusetts. It's a tough goal, but it's one that is really important. And and the affordability question is on the other side, where along with the subsidies through the Affordable Care Act, there's all sorts of things going on at the state level where we're really trying to make it as affordable as possible.
But as departments are all interconnected all the time, do we see this operating as some sort of an economic boom for the state? Being more people having a little bit more spending money in their pockets, or just people overall living a better lifestyle? For those people who feel like that would be
I think it's really a lifestyle question. I mean, this is the kind of thing where people are more willing to go for their yearly physical, maybe get an annual mammogram, that kind of the kind of preventive care that you may not get because you don't have health insurance, or you may be sick and you're like, you know what, I can't afford to go to the doctor, I don't have health insurance, and cold turns into pneumonia and it gets really bad and you're really sick. When people have insurance, they use it, and that's really what this is about.
Okay.
We have a great healthcare system in Massachusetts, and we want to get people in the door using it.
Getting people in the door using it. What would you say to those people who haven't explored the program yet? I've asked this before, but it's important people know at least what questions they're going to be faced with when they do.
Sure, yeah, it's it's obviously worth taking the time. Our website is mahealthconnector.org. If you're in it, you can go on. You don't even need to create an account. You don't have to tell anybody who you are. You can just take some time and sort of anonymously shop and browse and look at the plans and see what's available. And if you want to get to the point where you want to apply, it'll probably take you about 45 minutes, give or take. But when we're talking about something so important as health insurance, it's, a few minutes is more than worth the investment.
Right, exactly. Jason Lefferts, thank you so much for coming on and talking to us and answering some of our questions about how the state's transitioning. Thank you so much.
Of course, it was great. Thank you.
I appreciate it. Thanks for being here. And October is Breast Cancer Awareness Month. After the break, we're going to talk about what you can do to help yourself, protect yourself, and others who may be facing the disease. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. We have been discussing the Affordable Care Act. Now we're going to switch gears just slightly to another subject concerning health care, breast cancer. We're talking about October is Breast Cancer Awareness Month, and this annual campaign was designed to increase awareness and help people create a plan for detection and, if necessary, treatment. Breast cancer is the second leading cause of cancer death in women after lung cancer, and in the U.S. it is estimated that over 200,000 women are diagnosed with breast cancer every year. More than 30,000 will die from the disease, sadly, and that's what we're here talking about today. Joining us now to talk to us about this very important subject, we have Angel Davis from the American Cancer Society, and we have Kathy Glista, a breast cancer survivor. Thank you both so much for being on. Congratulations for getting through the fight. You were just telling me off camera that you're how many years?
13 years.
Congratulations.
I was diagnosed in 2000.
Well, it's very important that we talk about this all year round, but of course the focus shifts to breast cancer specifically in October. Why don't you first start off by talking to us about why it is important that you raise awareness on this issue?
Yeah, definitely. I mean, like you said, we should be talking about all cancers, especially breast cancer, all year round, but especially this month, we want to take the opportunity while we have it to give people the knowledge to stay healthy. If they are, going through a breast cancer diagnosis, the things they can do to help their everyday care of life, and then also to the programs and services that we have, if you are diagnosed. So staying healthy and preventative care is the main goal this month, obviously raising awareness, but for those people who have been diagnosed already, like Kathy, we want to give them the knowledge that we have programs and services, and so many organizations have programs and services to help them combat that.
So let's talk about the when. Many women hear different studies and reports all the time about when you should start getting detected, get a mammogram. What is your opinion on that? When is it appropriate for people to get started?
So the American Cancer Society's guidelines are pretty similar to those out there, but like you said, there are a lot of different things going around. There are rumors. Our guidelines are that between the ages of 20 and 30, you start receiving a clinical breast exam with your doctor every 3 years. So, always being aware of your general breast health, and, if anything feels different, letting the doctor know, but getting that clinical exam every 3 years, and then at age 40, receiving an annual mammogram. So that's our standard that we hold. There are some organizations that have different standards, but we have found through our research that that is the easiest way and the best way for early detection to, find these things out and get the preventative care that they need.
Okay. I have to ask you, Angelina Jolie announced earlier that she had a double mastectomy after learning she had a 90% risk of developing breast cancer. This is something that people have spoken about and sort of weighed in on. What do you think about going ahead and doing something like that ahead of actually being diagnosed?
So I think that all preventative care is good care. I think it's a very personal decision, and everyone's going to have a different opinion. Everyone's body is different, so I'd say definitely talk to your doctor and see what the best decision for you is. The American Cancer Society has actually developed some medications that help to prevent and decrease the incident rate of a certain gene. I believe it was the same gene that Angelina Jolie had. So everyone's doctor is going to give you a different recommendation. Personally, I think any preventative care that can help you is good. So if I were in that situation, I probably would have done the same thing as her to prevent it before you get sick. That way you don't have to go through it. But
what are some preventative steps that you can take? Does things like exercise fall into that?
Yeah.
What exactly can you be doing?
Absolutely. There's a number of things you can do. There's 3 main ones. We ask that you maintain a healthy weight, get some daily exercise. So I believe 120 minutes a week is what we hold to be sufficient, and then reducing your alcohol consumption. So keeping it less than 1 cup of alcohol a day will generally help to prevent any type of breast cancer in the future.
Okay, and Kathy, I want to ask you, just because there are so many different, I think you should start getting tested at this age or that age. When did you get tested? How did you find out?
Yeah, well, see, I was one of the lucky ones because I did have insurance that would cover my baseline mammogram before 40. And my primary care said, just go get a baseline done in case. It's good to have a baseline. And I was 38 years old. And when I went to have my baseline done, they found stage 2 breast cancer.
Wow.
So I was one of the lucky ones. I was actually diagnosed the day after my daughter's 12th birthday.
So was this your first time going to get tested?
It was my very first mammogram, and they found cancer.
And I'm sorry, you were how old?
38.
38. What was that like for you at age 38?
It was very frightening. As I say, my daughter was 12, my son was 9, and I was afraid I wouldn't even be around to see them graduate high school. And one of the problems, or the challenges I guess I had, was I would go to support groups, and a lot of the people in the support groups were older than I was, and so they were concerned about seeing their grandchildren graduate, and I was concerned about seeing my children graduate. But as I say, I was one of the lucky ones because I had insurance. And I remember thinking, how do people without insurance get through this? And so I'm glad to see that there is help for them to get what they need. And the other way I dealt with it was once I had been through my treatment, I had a lumpectomy, chemotherapy, and radiation. I lost all my hair and couldn't stand the wig, so I wore a button that said hair by chemo and got through it with a lot of laughter and good support. But one of the things I did was start volunteering for the American Cancer Society so that I could help others to get through it.
You have such an amazing spirit and sense of humor, also going through such a difficult time. I do want to take a short break, and we'll come back and we can talk about this struggle and why you wanted to work with others to help them, for those people who are watching at home today. So stay with us. We're going to continue this conversation after this. You're watching 22 News in Focus. Welcome back to 22 News in Focus. We are talking about Breast Cancer Awareness Month and how you can plan for detection and treatment. Joining us again, we have Angel Davis from the American Cancer Society, and we have Kathy Glista, a breast cancer survivor who just started telling us her story when you were diagnosed, some of the thoughts that were going through your mind. You were only 38 years old when that happened with 2 kids at home. So tell me what this road was like for you looking back.
I am, and I know I said it already, but I'm one of the lucky ones. I had a lot of support from family and friends. But it was scary. It was very scary. There's a lot of waiting in between things and not knowing. I've learned a lot since then, and as I started to say, about a year out from treatment, I began volunteering with the American Cancer Society. I've been a Reach to Recovery volunteer, which means that newly diagnosed patients get referred to me through ACS, and I call them up and try to help them in a way that family and friends really can't because they haven't walked that road.
What would you say, what do you know now that you wish somebody had been able to tell you in the beginning? There may be people at home watching who are recently diagnosed, have a family member who are diagnosed, and are just kind of wondering what's ahead, what's next. What would you say to those people?
Well, first of all, I think I would say make sure that you have a support system, and one of the best support systems is the American Cancer Society. They're there with information, with help. That's so important, and it's important because as much as family loves you, they're too close to it sometimes to give you the advice that you need. Other things I learned, I was not aware before I went through this, how many men are diagnosed every year with breast cancer, and what stigma is attached to that. And so I guess I want to say, if there are any males out there, we know you're there and we want to support you as well. American Cancer Society is not just about the women who have been diagnosed.
Wow. Now, what's interesting is Kathy said she was diagnosed at 38, but many, you said federal guidelines are that women don't get tested until around 50?
There are some speculation, I'm not exactly sure, but that's a stigma that women have heard that, you know what, well, I can't be tested until 50. And if you need a mammogram like Kathy, we will find someone who at 38 you feel like you need to go in and get a mammogram, we'll find someone who will provide it for you. So there's a lot of different numbers out there, and we hold that our number is 40, but even if you feel like before that you would need one, we want to find someone who can get it for you.
And she said one of the best resources she had was the American Cancer Society, and you have people standing by. Is this 24/7?
Absolutely. We're the only organization in the nation that has a completely toll-free, 24 hours a day, 7 days a week support line. So if you need any information on mammography, Look Good, Feel Better, our Reach to Recovery program, we would provide you with that and match you with someone locally. So that number is actually 1-800-227-2345. So 1-800-ACS-2345. And you know, they can give you anything that you would need if you're up in the middle of the night and you just can't sleep and you're wondering, well, something doesn't feel right. You can call that number and they'll get you the help that you need.
Wow, that's
So
wonderful. And she brought up a good point as well, that many men are diagnosed with this as well. How do men get tested for this? Is that
So as of now, there isn't a guideline for preventative care for men, as the same as women, just making sure that you're watching how you feel and things feel right. You know, if something doesn't feel right, go in and talk to your doctor. There isn't a standard for preventative care right now. That's something that our researchers are working on, trying to find a way to test and prevent that, but currently there isn't. This year, over 2,000 men will be diagnosed, so like she said, we don't want to forget them. We have programs. Our Look Good, Feel Better program, which was originally based for women, we actually have a Look Good, Feel Better program for men. So we help them deal with the non-medical side of, you know, coming with a breast cancer diagnosis, and we don't want to forget them. Our researchers are working diligently to find a way to help prevent breast cancer for them.
Kathy, how has your life been changed by all of this as well? What is life for you like now?
I think that I value life a great deal more. I know a lot of women dread birthdays, and I celebrate them. Just like the American Cancer Society says, I celebrate every day that I get, and it's made me a lot more tolerant of people, and just want to live life to the fullest. Another thing I think I would say to people is don't be afraid to talk about your cancer. I've heard many a story from people who were diagnosed years ago about how it used to be the big C and we didn't talk about it. And I think it's important to talk about it. I think it's important to share what's going on in your life. Just a little story is, at one point, I didn't like my wig, so I didn't wear it a lot, and I had a little girl in a restaurant say, "Mommy, is that a lady? What happened to her?" And the poor mother, I felt bad for, but I turned around, I got down to the little girl's level, and I said, "I was very sick, and I had to take medicine stronger than anything you'll ever have to take, and it made my hair fall out. But it's going to come back, and it might come back a different color, or it might come back curly, and I'm just waiting to see." And when I stood up after saying that, I realized everyone in the room was listening. But the point is, I helped that child to understand, so that the next person they see who has no hair or who is a little different, hopefully they won't say it out loud. They'll be able to understand that it's okay. We can get through this. I've been very blessed with two wonderful children who, you know, do the walks and call me during survivor laps, and just talk about it. Talking about it helps. And that's another thing. Not only does it help you, it can help your family. My daughter was a speaker for the American Cancer Society her senior year of high school, and we would speak in high schools, and inevitably she would have other young people come up to her and say, "My grandfather's going through this and nobody will talk about it," or "My grandmother," and not just about breast cancer, but it used to be such a taboo subject, and I really think that we help each other when we talk.
And those walks grow every single year. There are a number of people who may be just affected. There are just so many people who are affected by it. And like you said, there is no one size fits all. You were very young, sitting amongst older people who are. I want to thank you so much for coming on and sharing your story. And thank you so much for being here and speaking on behalf of the American Cancer Society and answering some of our important questions during this very important month of awareness. Thank you so much. And we're going to have the last word for you after the break. Stay with us. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we talked about the Affordable Care Act and how we'll be implementing it here in Massachusetts. We also talked about problems they've experienced and what they're doing to prepare for the full implementation next year. We also had the chance, in observance of Breast Cancer Awareness Month, to talk to a cancer survivor and get the facts on who should be tested and how often. We hope you learned something from it. And that is our program from today. We want to thank our guests for joining us, and we want to thank you at home for watching. If you've missed any of it, you can watch our program in full on our website, website at wwlp.com. From all of us here at 22 News, we wish you a wonderful Sunday.